Today, I will share with you the standard blood pressure and heart rate for people over 65 years old. Many people have received widely circulated false information, which has many versions, but usually starts with something like this: breaking news on blood pressure. The United States has officially stipulated that the standard blood pressure for those over 65 is 150/90. Even older individuals, 160 or even 170, are considered normal. Additionally, it's often said online that as people age, their blood pressure naturally rises, so older individuals don't need to control their blood pressure as strictly. Even 150 to 160 is okay. Dr. Hong Huifeng, a cardiovascular expert at Starlight Hospital, emphasizes the importance of blood pressure management. Effectively controlling blood pressure plays a significant role in preventing stroke, heart disease, dementia, aortic dissection, kidney disease, and other health risks. It's true that blood pressure increases with age, but it doesn't mean that as people get older, their blood pressure should necessarily be higher. Rising with age and letting it become elevated are entirely different matters. For example, as people age, their bones may become more brittle, but it doesn't mean we should let them become increasingly so. Asians are more prone to strokes, and the relationship between strokes and blood pressure is significant. In other words, our blood pressure requirements are different from those of Westerners. The greatest impact of blood pressure is stroke, not heart disease. Therefore, the most crucial factor in determining the ideal blood pressure value is the likelihood of stroke in the population, whether it's high or low. 3 studies on the ratio of strokes to myocardial infarctions in East Asians showed that the number of strokes in East Asians is 4 to 8.7 times that of myocardial infarctions. However, for studies on the ratio of strokes to myocardial infarctions in Caucasians in Europe and America showed that the number of strokes in Caucasians is 0.8 to 1.7 times that of myocardial infarctions. Another scholar, Shang Daohong, who died in 2009, compared the proportion of deaths from stroke or myocardial infarction in 24 countries published in a cardiology journal, which also showed the same conclusion. Compared with Caucasians in Europe and America, the proportion of strokes in East Asians is much higher than that of myocardial infarctions. For healthy adults, the ideal blood pressure should be less than 140/90. However, for people over 65 years old, the requirement can be relaxed, and blood pressure less than 150/90 is also acceptable. The standard heart rate is 60 to 100 beats per minute, but for some special occupational groups, the heart rate may be lower than this range. However, as long as the body feels fine, there's no need to worry too much. For diabetic patients over 65 years old, attention should be paid to measuring blood pressure and heart rate. If there is basically no change in heart rate before and after exercise, it indicates that there's a blockage in the carotid artery, heart, or brain blood vessels, and plaques have formed, so prompt examination is required. It may lead to acute myocardial infarction or stroke. When the heart rate is too fast or too slow, screening for underlying diseases should be conducted under the guidance of a doctor. It is more common for elderly people to have a slow heart rate, which may be due to sinus bradycardia or hyperkalemia. It is recommended to undergo further examinations such as electrocardiography in a timely manner when problems are detected and to treat them early. High blood pressure greatly increases the risk of stroke, and the most important factor affecting stroke is blood pressure. The lower the blood pressure, the less likely a stroke will occur. Of course, it shouldn't be too low, so the recommended blood pressure values for Taiwanese people are naturally different from those of foreigners. At the end of August 2021, Dr. Wang Zongdao of National Taiwan University Hospital and mainland China cooperated to publish a study aimed at clarifying the blood pressure control for Chinese people aged 60 to 80. Because it is a study of Asians, its importance far exceeds that of studies on Westerners. The study focused on 3 main points: the differences between Chinese people and Westerners, whether it's better to have slightly higher or lower blood pressure between the ages of 60 and 80, and the importance of measuring blood pressure at home rather than at the hospital. Should high blood pressure patients drink green tea or coffee? Which beverage can lower blood pressure without harming the body? According to a Japanese study, if one's blood pressure falls into the category of normal high blood pressure or mild hypertension, drinking a certain number of cups of green tea every day not only poses no risk but also has benefits such as lowering blood pressure and reducing fat. As for coffee lovers, they should be careful. Research has found that severe hypertensive patients who drink coffee may experience a sudden increase in blood pressure, increasing the risk of cardiovascular disease death. Research has shown that drinking more green tea is beneficial for hypertension, lowering blood pressure and fat. Nutritionist Zhuang Xingyue pointed out that in 2022, a Japanese research team published a prospective observational study in the American Heart Association Journal. The study involved 18,609 participants whose blood pressure readings were divided into 6 categories: ideal blood pressure, below 120/80 mmHg, normal blood pressure, below 138/85 mmHg, normal high blood pressure, 130-139/85-89 mmHg, stage 1 hypertension, 140-159/90-99 mmHg, stage 2 hypertension, 160-179/100-109 mmHg, and stage 3 severe hypertension, 180/110 mmHg or higher. The results showed that for those with ideal blood pressure or mild hypertension, drinking coffee posed no risk, but for those with stage 2 severe hypertension or stage 3 severe hypertension, drinking more than 2 cups of coffee a day could cause a sudden increase in blood pressure and may even double the risk of death from cardiovascular disease. As for drinking green tea, there is no risk at all. Even for those with ideal blood pressure or normal blood pressure, drinking 1 to 2 cups of green tea a day is beneficial. Those with normal high blood pressure or mild hypertension can benefit from drinking 5 to 6 cups of green tea a day. Zhuang Xingyue added that green tea contains a large number of beneficial polyphenol, such as catechins, e.g. CG, which can help fight inflammation, oxidation, reduce fat, and lower blood pressure. Moreover, among those who drink more green tea in the study, the total cholesterol is lower. For those with severe hypertension who drink more than 2 cups of coffee a day, the death rate from cardiovascular diseases doubles. Although coffee contains not only caffeine but also chlorogenic acid, magnesium, and cafestol, which can lower blood cholesterol, reduce inflammation, and improve endothelial cell function, for the general population, it can counteract the negative effects of coffee on the cardiovascular system. However, it may have negative effects on those with severe hypertension. To lower blood pressure, it's recommended to substitute green tea for coffee, engage in weight loss, exercise, and maintain a balanced diet. Regarding how to lower blood pressure, it's important to remind the public of the following. Maintain a peaceful lifestyle. Many diseases people suffer from may be related to their mood. To maintain a healthy body, it's essential to keep a peaceful mindset. Being frequently angry or irritable can affect one's blood pressure. Therefore, it's crucial to adjust actively and strive to maintain a pleasant mood every day. Quit smoking and drinking. For people over 65, if they want to control their blood pressure and stabilize their mental balance, they must pay attention to quitting smoking and drinking in their daily lives. Prolonged smoking and drinking not only damage the liver, lungs, and other functions but also stimulate damaged blood vessels, leading to high blood pressure and irregular heartbeats, which can induce cardiovascular diseases and affect personal health. Therefore, it's advisable to quit these habits as early as possible. Maintain a healthy diet. As the saying goes, illness comes from the mouth. Diet is crucial for everyone. For middle-aged and elderly people, as they age and their physical functions decline, it's essential to strictly demand their diet. To stabilize blood pressure and heart rate, it's necessary to maintain a light diet, eat more easily digestible foods rich in protein and vitamins, reduce the burden on the body, and supplement the body with necessary nutrients to maintain health. Exercise regularly. Life is ongoing, and so is exercise. Persisting in aerobic exercise for over 35 minutes every day not only helps increase basal metabolic rate but also promotes personal blood circulation. However, elderly people should choose appropriate exercises based on their bone health during exercise, such as jogging, walking, tai chi, swimming, yoga, cycling, and square dancing. Stay hydrated. For people over 65, as bladder capacity decreases, they may experience frequent urination issues. To reduce the frequency of nocturnal urination, many elderly people dare not drink water. However, this may lead to increased blood viscosity and slowed blood flow at night, increasing the risk of stroke and heart attack. Therefore, it's essential to drink more water in daily life, but avoid drinking large amounts of water before bed. For those whose blood pressure and heart rate do not meet the standards after the age of 65, the most important thing to do is to undergo examination and treatment. However, this requires more specific guidance from doctors in terms of treatment plans and medication selection. What we can do is the following. Maintain a calm lifestyle. Many diseases people suffer from may be related to their mood. To maintain a healthy body, it's essential to keep a peaceful mindset. Being frequently angry or irritable can affect one's blood pressure. Therefore, it's crucial to adjust actively and strive to maintain a pleasant mood every day. Quit smoking and drinking. For people over 65, if they want to control their blood pressure and stabilize their mental balance, they must pay attention to quitting smoking and drinking in their daily lives. Prolonged smoking and drinking not only damage the liver, lungs, and other functions but also stimulate damaged blood vessels, leading to high blood pressure and irregular heartbeats, which can induce cardiovascular diseases and affect personal health. Therefore, it's advisable to quit these habits as early as possible. Maintain a healthy diet. As the saying goes, illness comes from the mouth. Diet is crucial for everyone. For middle-aged and elderly people, as they age and their physical functions decline, it's essential to strictly demand their diet. To stabilize blood pressure and heart rate, it's necessary to maintain a light diet, eat more easily digestible foods rich in protein and vitamins, reduce the burden on the body, and supplement the body with necessary nutrients to maintain health. Exercise regularly. Life is ongoing, and so is exercise. Persisting in aerobic exercise for over 35 minutes every day not only helps increase basal metabolic rate but also promotes personal blood circulation. However, elderly people should choose appropriate exercises based on their bone health during exercise, such as jogging, walking, tai chi, swimming, yoga, cycling, and square dancing. Stay hydrated. For people over 65, as bladder capacity decreases, they may experience frequent urination issues. To reduce the frequency of nocturnal urination, many elderly people dare not drink water. However, this may lead to increased blood viscosity and slowed blood flow at night, increasing the risk of stroke and heart attack. Therefore, it's essential to drink more water in daily life, but avoid drinking large amounts of water before bed. When measuring blood pressure, it's important to remember 4 things. Avoid exercise before measuring blood pressure. Before measuring blood pressure, avoid any physical activity. Some people don't rest for a few minutes before measuring their blood pressure, which will inevitably result in deviations in the blood pressure readings. Additionally, staying up late the night before or smoking and drinking coffee before measuring blood pressure will also lead to deviations in blood pressure measurements, making it seem like blood pressure fluctuates suddenly. Pay attention to the measurement time. Normally, blood pressure can be measured at any time when feeling uncomfortable. However, if there is an abnormality in blood pressure, 3 measurements are generally needed. Choose the arm with slightly higher blood pressure. People often debate whether to measure blood pressure on the left or right arm. In fact, There is a certain difference in blood pressure between each person's left and right arms, but the difference is usually not more than 20 millimeters of mercury. Generally, the blood pressure in the right arm is slightly higher than that in the left arm. Therefore, it's recommended to measure the blood pressure in the right arm. However, it should be noted that some people may have higher blood pressure in their left arm. Therefore, it's recommended that when measuring blood pressure for the first time, measure the blood pressure in both arms and choose the arm with slightly higher blood pressure for subsequent blood pressure measurements. Adjust the cuff loosely. Adjusting the cuff too tightly or too loosely can also affect the accuracy of blood pressure measurements. Studies have shown that improper cuff adjustment can increase blood pressure readings by 2 to 10 millimeters of mercury. Therefore, it's recommended that, especially for overweight individuals, when purchasing a blood pressure monitor, check whether the cuff fits the arm. When measuring blood pressure, the lower edge of the cuff should be 2 to 3 centimeters above the elbow joint, and the tightness of the cuff should be just enough to allow one finger to enter. With the changes in the pace of life, many people may experience sub-health conditions. For this group of friends, it's easy to have high blood pressure in their daily lives. Therefore, when measuring their blood pressure daily, paying attention to the above 3 points can make their blood pressure measurements more accurate. Today's sharing ends here. You are never alone here.